Assalamu alaikum. My name is Dr. Marian. I'm consulting gynecologist and subfertility advisor. Today the topic of my discussion is it safe to have intercourse during pregnancy? It is a very sensitive topic. So many female patients come in OPD and they used to ask this question. And there are so many shy females who can't ask me this question. That's why I'm making this video to make them aware about this topic should be discussed. And I just want to say that my female patients, they can have intercourse during pregnancy from day one till delivery. It is safe to have intercourse, better to have once or twice a week. And but there are some conditions in which it is better to avoid, in which there is PV bleeding, there is the risk of miscarriages, placenta is low lying, or if cervical stitch is to be applied to the female patient, and the other condition is PV leaking. If there is pre-prom or prom, so better to avoid intercourse. If these conditions are not prevailing, so you can have safe intercourse at any time of pregnancy. And in some studies, it has been highlighted that if you are having intercourse once or twice a week, so it prevents against the preeclampsia, as well as it will have your player hormones are being increased and you feel much relaxed, and you have a strong bonding with your partner. And when these partners are strongly bonded, so they can take care of the child better. Thank you very much. I think so my topic has been clear, and now you can have any question. You can, if you have any other question, you can write it in the comment section.